CTV News infectious disease specialist Dr. Abdu Sharkawy joins me now. Dr. Sharkawy, always very nice to see you. So let me ask you about the latest. So the president has now been taken to hospital. What do you think that means? Is his state worsening, or is this prevention?
Well, I think it's premature to speculate too much, but suffice it to say, if you're going from a situation where he was, quote unquote, comfortably resting at home to now hearing that he has a fever and has received an antibody cocktail, we've heard, which is generally not administered outside of a hospital setting and is now requiring admission at the very least, it suggests that his condition is not so mild and he will need to be monitored much more closely. Is this a situation not unlike Boris Johnson's, where he was monitored and in the ICU but didn't in fact need ventilatory support, or is it one that truly indicates that he is deteriorating quickly? I don't think we have enough information to make that assessment right now.
But we can look at the age of the president, of the fact that maybe he doesn't exercise so much. He's not a man who reportedly is not in fantastic shape. So what is the risk factor here? And he's been holding large rallies, and, you know, he's been subjected to an aide who has been tested and has COVID-19. So with all these factors, what would be the risk level, in your opinion?
Well, it's definitely approaching high. It's not the highest, but it's in the higher category. And certainly once patients develop fever and they are deemed worthy enough for hospital admission, that increases the risk tremendously. You mentioned his age. He's also, by definition, obese. That's an independent risk factor for bad outcomes with COVID-19. So this is quite concerning, and I imagine that he'll be monitored very, very carefully over the next 24, 48 hours, and we'll be in a better position to determine what sort of prognosis he may have in the ensuing days, depending on how quickly the situation changes.
We are just want to tell our viewers that we are watching the helicopter. This is a live shot from the White House, the helicopter who seemingly is going to come to pick up the president and bring him to Walter Reed, the hospital. Now, Dr. Sharkawy, do you think this should change the way both parties have been campaigning, especially Donald Trump, who's mocked the vice president, his opponent, for wearing a mask all the time? Should this change the way that these campaigns are being fought?
Well, there's no question that this is a reminder that the political discourse and the political process of campaigning, you know, that really does not have a new set of rules that distinguishes it from any other social gatherings and anything else that increases the risk of transmission of COVID-19. We've seen, you know, a lot of media images of that famous picture in the White House now from Sunday, where there was a group of people, none of them masked, in close quarters. We've heard of staffers and aides who have been in meetings unmasked for long periods of time. The rules apply when it comes to COVID-19 transmission, regardless of who you are. And this should be a reminder to both campaigns that they need to take precautions. They need to distance. They need to do whatever they can remotely to avoid this sort of situation from unfolding.
And we're still seeing the live shot here at the White House, the helicopter waiting for the president to take him to Walter Reed. And Dr. Sharkawy, you stay with us here. This is, you know, not perhaps surprising. It is bad news, and we wish the president and his family well. Do you think that something like this could help medical officials, health officials, convince people that actually nobody is protected from this virus and that we have to protect ourselves, wearing masks, keeping social distance? Can we see, you know, a silver lining here?
Oh, absolutely. I think any time that you have a public figure, you know, whose profile is as large as President Trump's, there's an opportunity for a message to come across. And for those detractors or those, you know, loyalists, if you want to call them, who have been very dismissive and cavalier about their approach towards this virus, maybe this is an opportunity to help turn the tide a little bit, a sobering moment to remind ourselves that no one is immune to this. It doesn't really matter how many resources you have. We're told that President Trump had testing done frequently. It should also be a reminder that testing alone is not a guarantee that you won't get COVID-19. It is a snapshot in time. It may not accurately predict exactly when you have had your exposure. And so that's another thing that I think people need to recognize here, that the simple measures of distancing and masking and being very responsible with your meetings with other people, it's just something that cannot be overemphasized. That may be the one silver lining that comes of all of this, is having people recognize that no amount of affluence and no amount of wealth can protect you from this virus. It discriminates not.
And we're looking again at the White House, the helicopter, and the other shot is Walter Reed Medical Center in Bethesda. Dr. Sharkawy, so take us through what may happen. So the President of the United States is taken to Walter Reed, and then what? Typically, obviously, when a patient is not well, what are the steps that are taken once this patient gets to the hospital?
So ordinarily, the most common route is that basic blood work is done to ensure that blood chemistry is normal, that there is no signs of other organs that are failing or dysfunctional at this point in time. And the oxygenation is really the key initial parameter. Is he breathing comfortably, or is he requiring supplemental oxygen? And if so, what would be the degree of supplemental oxygen that's required? If he's already requiring supplemental oxygen, that's not a very good prognostic indicator and would suggest the possibility that he is perhaps sicker than has been let on. Chest x-rays and CT scans are often done in these circumstances as well to determine if they are consistent with COVID-19 alone, or whether there's a secondary pneumonia or other complicating infection on top of things. So all these factors are sort of assessed in real time to determine what someone may be at risk for, and whether their monitoring can occur in a relatively low acuity setting. I suspect in the president's case, he will probably be in a high acuity monitoring setting, more out of an abundance of caution than anything else. So I wouldn't want people to jump to the conclusion, if he's admitted to an intensive care unit, for example, that indicates that the worst is awaiting him. It's probably going to be a scenario like Boris Johnson's, where no chances are being taken and he's under a great deal of medical scrutiny and observation.
But he is a man who's a little bit older than the Prime Minister of Britain. I'm wondering, typically a man in his mid-70s who is taken to hospital, how long usually does it take? When do you know if this is critical or if he'll make it through?
Yeah, that's a difficult question to answer, because there is some degree of variability in how the immune system reacts to this virus, and in terms of the amount of what we call inoculum. What was the viral burden that caused the infection in a given case? I can tell you that based on the fact we now have been told that he has a fever, that indicates that the level of severity is certainly higher than has been let on. We normally see that progressing in a matter of days if it is going to get a lot worse. But that being said, we've also seen scenarios where people rebound after a few days of a flu-like illness. They kind of plateau, and then thereafter they compensate further. So I think it's too early right now to speculate as to whether he'll go down a more serious path or whether he'll stabilize. But it's certainly not a mild illness anymore. It's certainly not a very minor condition, given the situation that we have been apprised of at this point.